So I've been asked to speak with you a little bit today about the importance of survivorship. And survivorship's been defined in a number of different ways. The way that we generally use here is that survivorship begins at the time of a cancer diagnosis. And so in order to address people throughout survivorship, we need to address them in lots of different ways that focus on not just the biology of disease, but everything else that is going on with them as a person. So we can look, for example, at the domains of well-being, like how physically active they are, what their nutritional status is, how they deal with stress, what spirituality brings to their life, as well as real discrete and practical things like financial aspects of their life, as well as social aspects. So survivorship is vital because we can support people from diagnosis through treatment in such a way that we can help them to get through the treatment in a better way. And we know definitively that when people are able to go to treatments and get to treatments consistently and not have a lot of breaks in between, they do better. And then at the end of cancer treatment, which most people generally think of survivorship as beginning after all conventional therapy has stopped, we can then help people to prevent cancer from coming back with the same types of interventions that we know prevent cancer from coming up in the first place. And those include those same types of approaches: physical activity, nutrition, stress management, and really focusing on how we're able to manage all of those within the financial and social world in which we live. So survivorship is vital. We now have had several years in a row where we have increases in cancer survival overall. Our conventional therapies are getting much better at making cancer go away. We're also screening people at a much earlier rate, and that allows us to address disease when it's more localized. But when all the conventional therapy is done, the therapies that we give in order to address the cancer can oftentimes have more long-term side effects. So it's very important that a patient and their family know what they've been through, have that well defined, and that's really a key piece of education after treatment in survivorship. And then also know how to manage their health in such a way to decrease those side effects, as well as decrease the chance of the cancer coming back. So an approach that addresses the whole person from diagnosis all the way through the continuum of care till after they're done with their treatment is really now the standard of care in medicine. And that can be seen by looking at the NCCN guidelines. It can also be seen by looking at the Commission on Cancer from the American College of Surgeons requirements that in 2015, every Commission on Cancer certified program has to address survivorship, they have to address patient navigation, and they have to address psychosocial distress screening. And so what we're seeing is that it's vital, it's a part of standard care to provide supportive therapy during treatment and to provide guidance after treatment with regards to how to manage any late side effects of treatment, as well as how to live in such a way that we can maximally do what we can to help prevent any kind of recurrence or some kind of occurrence of another illness. Thank you.